Hi everyone, this is Chapter 20, Peripheral Vascular Assessment. And your learning outcomes. Your anatomy and physiology review, just so that you know where these arteries are that we're going to be assessing. So arteries receive the oxygenated blood from the heart and carry it to the organs and tissues, and the peripheral pulses that we're going to be assessing are the carotid, brachial, radial, the ulnar, femoral, popliteal, posterior tibial, and dorsalis pedis. And yes, you have to know how to say all those. So, health promotion, Healthy People 2020, reduce hypertension and hypercholesteremia, increase public awareness and screenings for the above disorders. Same thing I talked about with the cardiovascular system. This is just an extension of that. And here are 20 people, Healthy People 2020 objectives. So, lifespan considerations. Typically, we don't take blood pressures in infants, and sometimes in kids, it's usually probably not till about they're 3 years old. Making sure that you have the appropriate size cuff. Increased pulse rate with a fever, that's common in infants and children. Lymphatic system develops rapidly from birth until puberty. So just some things to be aware of. With a pregnant female, we are going to monitor blood pressure very closely for hypertension and any potential problems from that. Observing for any hypotension or low blood pressure during the third trimester. And the varicosities in the legs and the rectal area, because of the extra weight and pressure of the full uterus and the baby, hemorrhoids are common, and also varicose veins in lower legs are also common with pregnant female. With the older adult, sometimes there is an increase in blood pressure, and sometimes that has to do with the loss of elasticity in the blood vessels. Decrease in the pulse with some irregularities. A lot of times the calf vessels are enlarged, and you may notice some varicose veins. So like I said in the cardiovascular assessment, we need to make sure that we are taking into consideration the stress that somebody is experiencing, because it increases the workload of the heart. Cultural and environmental considerations. Again, hypertension, African Americans and Hispanics. Other risk factors for somebody to develop problems with the peripheral vascular system are obesity, family history, again, family history of coronary artery disease, high blood pressure, high cholesterol, and a sedentary lifestyle. Skin color variations. We are going to be assessing the skin when we assess the peripheral pulses. We want to, it's very important that we know that we're assessing the skin temperature. We're assessing the capillary refill on the fingers. I'll show you how to do that when I videotape the physical assessments. We're going to be looking at the colors of the palms and the feet of our individuals, and also in the mucous membranes should be pink. So even if somebody has dark skin, these are the places that still should, the capillary refill should still be the same. They should have good color on the palms and on the bottom of their feet, and also the mucous membranes. So that's where we're going to be checking for circulation on dark individuals. So focused interview. First thing we're going to ask is, do they have any problems with circulation? Do they have diabetes, varicose veins? Have they had any blood clots? What about hypertension, atherosclerosis? Have they had any skin changes, especially in their extremities, their hands and their feet? Do they have any sores or ulcers or any numbness? Any leg cramps? We want to know if they smoke. Age, well, with infants, if infant is very lethargic, that could be a problem. We need to also ask, does the child become cyanotic when they're crying? With the pregnant female, like I said, we're going to monitor blood pressure. We're also going to be looking for any swelling of the hands and face. Could be another indication of some complication. The older adult, I already talked about. Internal environment, you have medications, over-the-counter and prescription medications that can affect circulation. And environment, again, work, home, and also travel. As you are palpating, you're going to be inspecting, and then you're going to be palpating your peripheral pulses. And you're not going to be counting, so you can cross that out, the rate. The rhythm, you want to make sure that it is a steady pulse, that it's regular. Symmetry, you're going to be comparing the pulses on both sides of the body. So you're going to start with the carotid artery. You're going to palpate it on one side, then you're going to compare it to the other side. And the same with all of your pulses, your radial, your brachial. Again, all of your pulses, you're comparing the left and right. Pulse strength is assessed on a scale of 0 to 4. So 0 being no pulse and 4 being a bounding pulse. You are also going to be assessing for edema. Edema, again, is the swelling. Typically, we find it in the lower extremities, but it can also be in the hands. So, as a 142 student, all you need to determine is there edema or is there no edema? Then, if the person does have edema, you need to determine, is it pitting or non-pitting? The picture on the left shows pitting edema. That's when you press down and you leave an indentation when you take your finger away. Non-pitting edema, you can press down, take your finger away, and there is no indentation. This pitting edema is given a scale of +1 to +4. You don't have to determine that at this level. All you need to determine is there edema, yes or no, and is it pitting or non-pitting? As you gain practice, you will be able to determine if it's +1 through +4, and also some facilities have, it may be different millimeters that will determine the extent of their edema. And this is your documentation. And that's all I have for this. Again, I will be doing the videotaping of the hands-on physical assessment.